As Labour walk back into power, they plan to rejuvenate public services and give the likes of the NHS a new lease of life. Under the plan New Labour, New NHS, the government wanted to create a genuinely national health service with greater local responsibility and reduced bureaucracy. The cost of setting up the 300 plus PCTs remains a mystery. The Department of Health's response: we don't have the figures. When you think that each one had their own chief executive, non-executive directors, finance director, press department, and all the administrators that go with running an office, best guesstimates put the figure between £1 and £5 billion. So where did all the people who are going to run our health service come from? And was it not excessive to have quite so many local commissioners of healthcare? Labour has effectively gone full circle. You've had 6 major waves of reform. In its first term with Frank Dobson, you abolished the internal market, you abolished fund holding. Just before you became Health Secretary, John Reid brought in practice-based commissioning, essentially the same as fund holding, which was abolished. And now we've also got patient choice, which is effectively creating competition, the same as the internal market. We have effectively gone full circle. We're back to where we started. The PCTs are virtually exactly the same as the district health authorities.
Well, I've no doubt at all that we could have got to where we are now even quicker. And, hindsight...
Well, you could have got there quicker by just not changing what you had in the late 90s.
Well, let me just make the point. We could have got to where we are now quicker, and with the benefit of hindsight, it's easy to see that. But what I don't accept is that we've ended up in the place where we were in the late 90s. We simply haven't. You talk about...
So how is practice-based commissioning different from fund holding?
Fund holding was a minority of GPs. It was never universal. And what it did was give patients of fund holders faster treatment and queue jumping at the hospitals where they were being cared for. What we've got with practice-based commissioning is all GP practices involved in it, and actually a much more effective system as it matures for the GPs to make sure, for instance, that they're concentrating on people with long-term conditions.
So if you're saying that we should have done things faster, it would have perhaps been better to have taken fund holding further in your first term rather than waited 10 years scrapping it and then bringing it back in 2004.
Well, I think it would be lovely, with the great wisdom of hindsight, to say, could we have moved directly from fund holding to practice-based commissioning? Maybe we could, maybe we couldn't. I have to say it's all completely hypothetical.
For Yorkshire, £16 million was spent on redundancies. The chief executive of the then York and Selby PCT, I believe, walked away with £1 million payoff. And then at the same time, people are not getting referrals on the patient care that they need. It's quite a sort of juxtaposition. And then for some of them to then still be in debt and not providing care for their patients.
Well, every organisation faced with redundancies, and they're always horrible, but they do happen, public sector or private sector, has to decide how to treat people who are made redundant.
But £1 million is a bit obscene, isn't it?
£1 million is a very large payoff for somebody who has clearly worked in the NHS for a very long period of time. Otherwise, they wouldn't have been entitled to that sum of money.
Only for 2-3 years, because that's when they were reorganised again. So he wasn't there for that long.
Well, the terms of the redundancy package were all agreed between the Department of Health and, as far as I know, the trade unions. And frustrating though it is, it's actually not something that ministers are directly involved in. And I know that's going to sound like a cop-out. It happens to be the truth. And I do think, particularly
What's your personal opinion?
In the public sector, I think it is particularly important that we treat staff fairly, especially in the very difficult situation of a redundancy. And I'm not going to point the finger at an individual who has served the NHS for years and say, oh, I think you got too much.
And in Islington, school children have given the thumbs up to Jamie Oliver's healthy eating initiative. Catering company Scholarist, famous for serving turkey twizzlers, have been dropped by Islington Council. Mary Gibson, head teacher at Yearbury Primary, said she believes healthier food will provide better results. And there are fears of Islington becoming a new Soho after the landmark Archway Tavern has applied to stage late-night erotic dancing. If granted, the venue plans to have semi-nude pole dancing until 5 in the morning and sell alcohol, which residents believe could be drunk off the premises. Local councillor Stefan Kasprick warned the residents not to hold their breath over it being turned down. Well, that's all your news for now. Now back to Georgina. The US Secretary of State Condoleezza Rice has arrived in the Middle East to try and revive the peace talks between Israel and Palestine after 6 days of violence which has left 117 Palestinians and 3 Israelis dead. Both sides blame each other for starting the latest wave of fighting, with Hamas firing more than 40 rockets daily from Gaza into Israel and the Israelis responding with incursions into both the Gaza Strip and the West Bank. We cross now to our Middle East correspondent, Mariam Zahedi in Jerusalem, for the latest on the peace talks.
Well, Simon, unlike Hamas, the PLO had entered into dialogue with Israel and progress was being made, but the recent operation by Israel in Gaza has put a spike in the peace process.
Can we really expect a Palestinian state by the end of this year, as Condoleezza Rice has suggested, when Ayad Olmert only yesterday has threatened more incursions into Gaza?
Well, there has now been a cessation of violence and Israel's pulled its troops from Gaza. Through Rice's visit, the US does seem firmly committed to the Annapolis Agreement and bringing about a resumption in the peace process.
And Mariam, is Abbas, the leader of the Palestinians, at least in the West Bank, likely to come back to the peace talk table anytime soon?
Simon, do you want to kick off?
Well, I think he made a stand for civil liberties, but he did that on Wednesday. I think resigning is not the way forward. I think this is an incredible stunt, and he's really left David Cameron in the thick of it, because Labour is not likely to field a candidate. The Liberal Democrats have said no. They're going to be there having a debate with no one, or they're going to be having Kelvin Mackenzie, former editor of The Sun which the Tories are going to have to rely on if they want to get back in power. They're going to be pitching a battle against a very important part of the media.
But it draws attention to an important issue, and I think regardless of his motives, that's important.
It would draw attention to an important issue if Labour actually stood in it, and they can't actually make the Labour Party field a candidate. I mean, Labour's just going to ignore this. They're going to play the vanity game on David Davis.
And
One firefighter has died and 3 remain missing in what could be the worst loss of life for the fire service in 35 years. More than 80 firefighters worked through the night to tackle the blaze at a warehouse in Warwickshire. The police are treating the incident as suspicious, and questions are being asked as to why the firefighters entered the burning building. Maxwell Hall reports.